Good morning. We will now begin today's webinar. This webinar is the first webinar in the Direct Care Workforce Strategy Center series. Today's webinar is titled Federal Action to Address the Direct Care Workforce Crisis. Before we begin, we're going to go over some housekeeping items. All participants have cameras turned off and are muted. Participants are unable to communicate via the chat and the Q&A, but may receive messages from panelists. We also have ASL translation today, and CART is available by clicking on the link in the chat. CART will open in a separate screen, and the captions can also be switched to Spanish language interpretation in the upper right-hand corner of the screen. Should you run into any technical difficulties during today's webinar, please contact our team at conference@ncoa.org for assistance. Lastly, this webinar is being recorded. A copy of the slides and the recording will be available after today's webinar. And with that, I'd like to introduce Ramsey Alwyn, CEO of the National Council on Aging, who will begin today's presentation.
Thank you, and welcome to today's call. I'm Ramsey Alwyn, President and CEO of the National Council on Aging. At NCOA, we believe every person deserves to age well. For nearly 75 years, we have worked to deliver the resources, tools, best practices, and advocacy our nation needs to ensure every person can live and age with health and financial security. Like all of us, older adults and people with disabilities deserve to live in place in community as they choose. The direct care workforce makes that possible. But right now, we simply don't have the workforce we need to meet the ever-growing demand. Low wages, lack of full-time employment, and the pandemic have caused fewer workers to enter the direct care workforce at the exact time we need their services so very much. The Kaiser Family Foundation reports that in 2023, nearly 700,000 people were on waiting lists or interest lists for Medicaid, home, and community-based services. According to PHI, between 2021 and 2031, we'll need to fill 9.3 million direct care jobs in the United States. If we don't meet that demand, people will not get the services they need. Quality of care will diminish, and families will face increasing pressure to step in, caregiving, and providing services they're not equipped for. Now is the time for greater focus, attention, and coordination among federal, state, and local partners who are poised to help address this crisis. The Direct Care Workforce Strategy Center is a critical step in the right direction. The goal is to revitalize the direct care industry and workers and people receiving services so all can thrive. The Strategy Center will facilitate collaboration among state agencies, including Medicaid, aging, disability, labor, and workforce development systems, to improve recruitment, retention, training, and professional development for our direct care workers. NCOA is honored to administer these systems change efforts on behalf of ACL through the Strategy Center. We are leveraging our long history of leading cross-functional initiatives across many divisions of the government at the highest level. The center will also benefit from the tremendous expertise and commitment of 11 national partners who are all engaged in providing technical assistance, information, and research to support our joint goals for systems change. We applaud the leaders in the administration that have made this possible, especially the Administration on Community Living, for launching this timely and important investment in the direct care workforce. It is my pleasure to now introduce Allison Barkoff, who leads the U.S. Department of Health and Human Services Administration for Community Living, or ACL. Allison performs the duties of the ACL Administrator and the Assistant Secretary for Aging. In her role at ACL, Allison provides executive leadership and coordination for ACL programs nationwide and serves as an advisor to HHS Secretary Becerra on issues that impact people with disabilities and older adults. Allison is a lifelong advocate for community living who has worked tirelessly at the forefront of national efforts to expand home and community-based services that make community living possible for so many. She has appeared before Congress and the U.S. Commission on Civil Rights and has been a part of countless coalitions of people with disabilities, older adults, advocates, often in her role as a civil rights attorney. It is my pleasure now to welcome Allison. Allison, the floor is yours.
Thank you so much. Thanks, Ramsey, for that introduction, and welcome everyone. And thank you so much for being part of this exciting kickoff webinar that marks the start of a year-long series designed to help address the critical shortage of direct care workers. We are so honored to be joined today by speakers from the White House and leaders from across the federal government. Today's incredible panel of speakers demonstrates the administration's steadfast commitment to strengthening the caregiving infrastructure and increasing the availability of home and community-based services for older adults and people with disabilities. I want to thank my colleagues from across the government for joining us today. We want to make sure that everyone attending this webinar understands how seriously the federal government takes the direct care workforce crisis. Working with colleagues across the federal departments and agencies represented on today's webinar, ACL was able to create the Direct Care Workforce Strategies Center to strengthen collaboration across state agencies, direct care professionals, people receiving services, and other stakeholders to improve the recruitment, retention, and development of this critical workforce. A focus of the DCW Strategy Center is on partnerships. It's about partnerships across the federal government. It's about partnerships among state agencies, from aging and disability to Medicaid to labor and workforce development. And it's about partnerships with direct care professionals, people receiving services, and advocates. And we're modeling that partnership with all of the agencies on today's webinar and the breadth of partners involved in the Strategy Center. The direct care workforce crisis is not a problem that can be fixed overnight or by one agency or even by the federal government alone. It's going to take all of us working together, pulling in the same direction at the community, state, and federal levels. The direct care workforce is central to community living and the decades of progress that have made community living the expectation for people with disabilities and older adults. And that is now being put at risk by the direct care workforce crisis. Every week, we hear of providers having to turn away opportunities to provide support because of a lack of staff. This workforce shortage means people are placed at risk of having to enter an institution. It means that people with disabilities and older adults experience service disruptions and inconsistent care, placing both their health and safety at risk. It also impacts family caregivers who often must take on additional and ever more complex caregiving responsibilities, often at significant cost to their physical, mental, and financial well-being. The work by direct care professionals is critical, and they deserve the respect of everyone in our society. Yet the low pay is a sign that that respect is lacking. We must work together to change that. For so many people with disabilities and older adults, the difference between having the support of a direct care professional or not is the difference between living independently, going to work, and fully participating in their community or not. That or not should be completely unacceptable to all of us, because together we can find solutions. But there's another imperative. The number of people with disabilities and older adults in the United States is growing. And we estimate that by 2030, just 6 years away, 1.3 million new direct care workers will be needed, putting more demands on an already overstretched workforce. It's fair to ask, how are we going to address the future growing demand while also retaining the current workforce? We're here today to start chipping away at the current problem and building toward a future solution. There has been some help, especially from the American Rescue Plan, which has provided $37 billion in additional funding for home and community-based services. And every single state has used some of their American Rescue Plan funding to address direct care workforce issues. One goal of the Strategy Center is to find ways to sustain progress from these investments and continue moving forward. And a problem cannot be solved without a structure in place to address it and people coming together to find solutions. Solving this crisis requires new ideas and advocacy from across state government, people receiving supports, direct care workers, and all of the organizations and businesses and nonprofits and families. So that's everyone on this call. Over the course of the next year, we will share new ideas, learn from each other's successes, and implement strategies to address this workforce shortage. And although no one single solution can solve the entire problem, we can work together and make progress. Together, we will find ways to improve recruitment, retention, and development of the direct care workforce professionals. So let me close by thanking you and all of our federal, state, local partners, businesses, organizational leaders for joining ACL and the Direct Care Workforce Strategy Center to address this crisis. I would now like to introduce Jessica Schubel, Special Assistant to President Biden for Healthcare. Jessica has a long history working on the issues we're focused on today, including positions at the Center on Budget and Policy Priorities, and in various capacities at the Centers for Medicare and Medicaid Services during the Obama administration. Jessica has been an incredible champion in advancing the Biden-Harris administration's priority to expand access to home and community-based services and strengthen the caregiving infrastructure. Jessica, the floor is yours.
Hi, everyone. Oh, can you see me, hear me? I'm having severe technical, there we go. Okay.
Yes, we can hear you, Jess.
Technical computer issues today. So apologies, it was my fault for getting the show on the road started a little bit late. But hi, everyone. It's so nice to be with you here this morning. And just wanted to take a few minutes to build off of what Allison was saying in terms of the Biden administration's commitment to caregiving and home and community-based services and community living. I think, one of the reasons why I took this job was the opportunity to advance our caregiving and long-term care goals. There's, a significant access problem with Medicaid's home and community-based services, and making sure that people can get the care that they need when they need it in the setting that works best for them. And so I was beyond thrilled to be able to work with, my colleagues here in the administration to put together the package in the American Rescue Plan that provided enhanced funding for Medicaid's HCBS services. And I'm ecstatic that after everything was all said and done, $37 billion was delivered to states to improve, and strengthen their HCBS programs, including, supporting caregivers and family caregivers. And I'm also equally excited and proud to have worked alongside my colleagues in developing the first ever executive order on care. And we're closely approaching the 1-year anniversary mark of that CARE EO. And I am excited that we have pulled, a wide range of activities and commitments across the government. I think it's over 50 commitments actually in the first ever CARE EO. And it doesn't stop there. President Biden is committed to strengthening home care and the quality of caregiving jobs. You all are probably very familiar with the Medicaid access rule that we proposed last year, and we are full steam ahead in finalizing the rule and working on that. And hopefully folks saw yesterday's healthcare fact sheet that we released in advance of tonight's speech, the State of the Union, where we are doubling down on our efforts to continue supporting home care and the caregiving. And the president continues to call on Congress to invest in this space. We think it is very important, again, to make sure that we are supporting older adults, people with disabilities, and their families, and making sure that they can get the care they need in their homes, in their communities, when they need it, where they need it. So I just want to say thank you so much for all that you are doing to advance these goals, and I will turn it back over to Allison.
Thank you so much, Jess, and really appreciate the support that we have gotten from the White House and the real push to do everything we can across federal government to address this important issue. But it's not only the White House that is so interested in this work. I am really pleased that we have gotten incredible support at HHS from our very own Secretary Becerra, the Secretary of the U.S. Department of Health and Human Services. And on behalf of Secretary Becerra, I am really pleased to introduce Dr. Meg Sullivan. Meg is a board-certified pediatrician with extensive experience in public health, health equity, reproductive health, global health, infectious disease prevention and control, and emergency response. And she currently serves as a counselor to Secretary Becerra for multiple agencies, including, of course, ACL. She served as the Chief Medical Officer for the Administration for Strategic Preparedness and Response during the pandemic, and is currently helping to implement Secretary Becerra's Workforce Initiative. And we are thrilled that this initiative includes efforts focused on the direct care workforce. Meg, I'll hand the floor over to you.
Thank you so much, Allison, and good morning, everyone. I will just start off by saying that on behalf of the Secretary Becerra and all the leadership at HHS, I am so incredibly proud to be here today and have the opportunity to work so closely with Allison and all of the staff at the Administration for Community Living to support their incredible efforts to fulfill the work that they do every single day, including on this important initiative. And I'm just here today on behalf of Secretary Becerra to say just a few words to share both our excitement and our commitment to the incredible work of ACL across HHS and the entire federal government to address the direct care workforce crisis. I will just say emphatically, this issue has been and will continue to be a priority for the Secretary and for the administration. And I'm so appreciative today to have the opportunity to help share this work that ACL is leading to advance the Secretary's Workforce Initiative and the President's priority to strengthen the caregiving infrastructure, including implementing his Care Executive Order. We know, and we've already heard today, the critical home and community-based services that help persons with disabilities and older Americans live in their own homes and communities that are provided by the direct care workforce. We also, unfortunately, know too well the long-standing workforce shortages that reached crisis levels during the pandemic and just continue to grow. So to help combat this, as we have heard, last year, Secretary Becerra announced the launch of this important HHS Health Workforce Initiative, with the goal being to support, strengthen, and grow the health workforce by leveraging programs across the department. As we've heard, the department's initiative is focused on federal investments to support individuals across healthcare workforce disciplines. Not only physicians, nurses, dentists, behavioral healthcare providers, but also community health workers, peer support specialists, direct care professionals, and others who dedicate their careers to improving the nation's health and well-being. And I hope it goes without saying that this workforce initiative has equity at the center of the work in everything that it does. As we heard from Allison, HHS's initiative includes a coordinated department-wide effort to identify opportunities to improve health workforce recruitment, retention, and career advancement. And more specifically, ACL's Direct Care Workforce Strategy Center that was recently announced is such an important part of this HHS Health Workforce Initiative and builds upon the ongoing collaboration between ACL, the U.S. Department of Labor, the Center for Medicare and Medicaid Services, and the HHS Office of the Assistant Secretary for Planning and Evaluation. This Direct Care Workforce Strategy Center activities align so well with the department's initiative, as the Strategy Center supports collaboration across state agencies, direct care professionals, people receiving services, and other stakeholders to improve recruitment, retention, and development of this critical workforce. And as Secretary Becerra was quoted in the press release for this initiative, just like our efforts to support the development of clinicians and grow the behavioral health workforce, the Direct Care Workforce Strategy Center is an important component of our health workforce initiative. So I will just end by saying, on behalf of the Office of the Secretary, we are so excited to be part of this initiative and the broader efforts to address the direct care workforce crisis. And again, reinforce the commitment to all of the work that ACL, our federal partners, and all of you are continuing to do on this important issue. Allison, back to you.
Thank you so much, Meg. And again, I hope everyone can hear how much support we have from the top of the federal government, from the White House, from Secretary Becerra. And I am really excited that the rest of this call, we are going to focus on how we are really working together across the federal government, both with our own individual initiatives and so many initiatives that we are working on together. So I'm going to do a little overview of the many federal leaders that you will be hearing from next, and I think folks are going to pass it along to each other. Of course, we cannot think about the direct care workforce crisis without partnering with our friends and colleagues at the Centers for Medicaid and Medicare Services at CMS. We are so fortunate to have leadership at CMS who sees this as a top priority. You will hear from Daniel Tsai, the Deputy Administrator and the Director of the Center for Medicaid and CHIP Services, who has been an incredible ally and pushed incredibly hard on these issues, as well as from Melissa Harris, Deputy Director of the Medicaid Benefits and Health Programs Group, who has been just a longtime colleague and partner around HCBS issues with ACL. After CMS, you will hear from our partners at the Office of the Assistant Secretary for Planning and Evaluation. You'll hear from Tisa Marie Sherry, who is the Deputy Assistant Secretary for Planning and Evaluation. But it's not only in HHS that we are working together. We have critical partners in the Department of Labor, and I'm really excited that we have leadership from the Department of Labor who will share how they're working with us and the work that they are doing there. First, you will hear from Taryn Williams, who is the Assistant Secretary for Labor at the Office of Disability Employment Policy, or ODEP, and then from Kim Vitelli, who is in the Office of the Administrator in the Department of Labor's Employment and Training Administration Office of Workforce Development. And then at the end of the call, to wrap it all up, I am really excited that you will hear from my colleague, Caroline Ryan, who is the Deputy Director of the Center for Innovation and Partnership here at ACL, and who leads ACL's Direct Care Workforce Initiative. And she'll make sure you all know about the great upcoming technical assistance opportunities and other events. So with that, I am really privileged to turn it over to my colleague and friend, Dan Tsai.
Thanks, Allison. Thanks everybody for being here. I will just say a few things and then pass it to Melissa Harris on my team. As Allison said, this is an incredibly important topic for us, for this administration, for our team. People feel deeply passionate about making sure that we have a strong and robust system of care and access for all the many people we serve, for home and community-based services, for long-term services and supports more broadly. And underlying that, importantly, is the workforce. And I feel, Allison and I talk about this all the time. When we're out on the road, all we hear about is how much of a workforce challenge we are in. And that ripples through to every part of the continuum. And whether you're on the provider side, family caregiver, someone with lived experience, a state, all of that, the workforce challenge is incredibly real and daunting as we think about making sure that there is sufficient and timely access for the whole range of supports that people need to stay as independent as possible, and also to thrive in whatever setting of care they are in. And we at Medicaid at the federal level for home and community-based services and long-term services and supports, we are the predominant payor outside of private pay in some cases. And so it is a really important, solemn responsibility. So a lot of the work that we have been partnering with many of you all on has been, how do we make sure that there is sufficient and timely access? How do we ensure that there is appropriate support of direct care workers, including ensuring that a sufficient component of provider reimbursements really are geared towards the direct care workforce? How do we help make sure that we can, with both flexibility and accountability, support all of the incredible amounts of funding that were through the American Rescue Plan 9817, the enhanced funding for home and community-based services, the 25 billion plus that has been planned or spent by states to help enhance access to HCBS, including through support of providers and training and retention bonuses and all the things of that sort. Those really have both motivated our team and have been the subject of really exciting things that we've seen across the country. Excuse me, everybody. So I just want to reemphasize and highlight how important this is to all of us, the breadth of work that is happening. Funding is not going to solve the entire issue, but it's a really important part, as are many different policy pieces, to make sure we're measuring and supporting and ensuring that there really is sufficient access for the people that we serve. So those are some high-level thoughts. Again, if you're on this call, you care about this, and you know how intractable these problems are at some points, and also how gratifying and exciting it is to try to forge more paths to solving some of these challenges, which start with ensuring a sufficient direct care workforce and extend to all the different parts of the ecosystem, from individuals, family caregivers, states, providers, health plans, advocates, councils on aging, others that really are and also on the disability side that really important as this. So thank you all for that. And I'm going to turn it to Melissa Harris on our team to walk through a little bit more of the substantive detail from a Medicaid standpoint. So over to Melissa. Thank you, everybody.
Thanks so much, Dan. My name is Melissa Harris, and I'm a Deputy Director in the Medicaid Benefits and Health Programs Group. And I'm really so happy to join this important conversation today. And I'm going to provide a little more detail on how Medicaid is assisting states and providers in being able to ensure access to Medicaid-funded services. You have heard a few people today mention the American Rescue Plan and the infusion of federal dollars that brought to shore up the home and community-based services infrastructure during the public health emergency. The funds were to be used by states to enhance, expand, and strengthen Medicaid-funded home and community-based services. And states have done an enormous amount of really innovative work to do that. And a major part of that funding has been devoted to strengthening the direct service workforce. So I'm going to highlight a couple of specific activities that funding went for. States used the American Rescue Plan funding to do things like offering sign-up or incentive payments to the direct support workforce, increasing payment rates to the direct service workforce, and establishing career paths, creating registries to help match workers with beneficiaries in need of services, and providing portals to help providers better manage the workforce. States also use that funding for training of individuals in the direct support workforce, training not only to providers that we normally think of as delivering services, but family caregivers and others. Establishing online training platforms and offering certification programs and tuition support to providers, caregivers, and the direct care workforce to help further their careers and retain those individuals in this workforce. We have issued a lot of information in the last couple of months on state uses of ARP funding. And all of that information is on our Medicaid.gov website. And so I'll plug it here and you'll hear me plug it again before I stop. But please feel free to look at our Medicaid.gov website. There's a ton of national and state specific information about how states are using ARP funding for a whole host of things, but really premier among them being stabilization of the workforce. I mentioned registries a minute ago. We also issued a separate piece of guidance, an informational bulletin, late last year. In December 12th, as a matter of fact, talking about the use and the benefits of establishing registries that link direct support workers or direct care workers to individuals who need services. And that informational bulletin walks through some of the roles that a registry can play, some of the benefits of using it, and talks about enhanced administrative federal matching that can be available in the establishment and maintenance of those registries. And again, that informational bulletin issued on December 12th, 2023 is available on our Medicaid.gov website. We've also issued a wide array of other publications, other resources to talk more generally about the direct support workforce. We issued a whole series of information spotlighting adults with individuals and developmental disabilities and their aging caregivers, and how states can bring some specific supports to that population. We have also earlier in 2023 released an online training course and a series of resources that offer strategies and information on self-direction, also with an eye towards strengthening the direct service workforce in rural areas, and talking about some strategies that emerged from a learning collaborative we had on the direct service workforce in 2021. So you can see that we've been having some really dedicated conversations about this issue for the last several years. None of these issues are going to be the single thing that solves the direct workforce crisis, but this is all in the name of publishing tools to help states, providers, advocates, all stakeholders understand the various options under the Medicaid program. We do have a direct service workforce page specifically on our Medicaid.gov website, and I invite you all to take a look at it. And then lastly, I'll end with a little shout out to a pending regulation that we have in CMS. It is called the Access Regulation, and it does all sorts of things under the umbrella of furthering beneficiary access to Medicaid services. And there's a whole host of home and community-based services provisions in that proposed rule. And you may be familiar with one specific provision that talked about requiring 80% of Medicaid payments for key services, personal care, homemaker, home health aid, 80% of Medicaid payments for those services to be passed to the direct service workforce in the form of compensation. That provision was in our proposed rule. We are analyzing comments. The final rule will be out when it's released, and we will be happy to have much more in-depth conversations at that time. But that is also another lever that this administration has made available with an eye toward shoring up and stabilizing, not just in the short term, but in the longer term of the direct support workforce. So let me stop there. I really appreciate you including me today, and I'm going to turn it over to Tisa Marie in ASB. Thanks.
Thank you so much, Melissa. It's wonderful to be here. So thank you all so much for joining. My name is Tisa Sherry, and I'm the Deputy Assistant Secretary for the Office of Behavioral Health, Disability, and Aging Policy in ASB, which is the Office of the Assistant Secretary for Planning and Evaluation. I have just a few slides. Next slide, please. For those who are not familiar, and we can skip one more ahead. Thank you. So for those who aren't familiar with ASPE, our role in the department is to advise the secretary on policy development in health, disability, human services, data, and science, and provide analysis on economic policy. Within my office, we focus on research and policy analysis to help us support the caregiving infrastructure and also increase the availability of home and community-based services for older adults and people with disabilities. As you've heard so far from our other federal partners, we recognize the shortages in the direct care workforce to be among the most significant policy challenges that we face to realizing our goal of ensuring that older adults and people with disabilities can continue to age and be well within the settings of their choice, most commonly within their communities. And so we are very proud to support the work of the Direct Care Workforce Strategies Center by disseminating research, data, and evidence, and working with our state partners collaboratively to ensure that we are collectively adding to our knowledge base about the most effective policies to address this really critical challenge. We need data to inform our work on the direct care workforce for a number of reasons. First, to see where we are in our progress on meeting the growing demand for workers, to help guide and improve our workforce planning efforts, to improve access to high quality services, and to inform policies to support these workers, but also importantly, evaluate the impacts of the policies that we're putting out there. Because until we know what really works well, that is what will help us optimally scale and address this critical challenge. And so we're very excited to contribute, by helping to inform and advance the evidence base on this. Next slide, please. Just to share a few examples of some of the ways that ASPE has supported this work. We've had a long history of both helping to contribute to advancing and establishing a data infrastructure on the direct care workforce, on conducting policy research and evaluation, and also on helping to convene and disseminate this information. Some examples of how we've helped in partnership with our colleagues at the National Center on Health Statistics to expand the data infrastructure include the National Nursing Assistant Survey, which is the first national survey of CNAs working in nursing facilities, and also the National Home Health Aid Survey, the first national survey of home health aides providing home health or hospice care in the US. Our historical research on this topic has included analysis of state efforts to comply with the Fair Labor Standards Act protections to home care workers. As far as convenings and dissemination, we've been proud in the past also to partner with our colleagues at the Department of Labor to put together a symposium on the relationship between workforce development and quality jobs. Next slide, please. More recently, our work has included an analysis of of national and state trends in the wages of direct care workers. Among which one of the more striking findings was that in many states, direct care worker wages, in particular for personal care assistants, are often lower than entry-level wages for other occupations. Which really highlights the key challenge we face in recruiting and retaining this vital workforce. Our recent research has also just in the past year has included case studies of state efforts to improve direct care workforce wages, analyses of how to mitigate worker injuries, which we know are a major reason for turnover and retention challenges in this workforce. And then, of course, research examining how the COVID-19 pandemic has affected our direct care workforce challenges. Next slide. And then some other work that is currently underway that you can stay tuned for include a case study specifically of New Jersey and the effects of state Medicaid policies on home care workers in that state. an updated analysis of the relationship of national and also state level trends in direct care worker wages now that we are now that we're kind of later on post COVID-19 pandemic. Also a study modeling the impact of setting a minimum wage for direct care workers. And in addition, we're proud to be partnering with our NCHS colleagues to continue to try to expand and build upon the workforce data infrastructure through a pilot study of direct care workers in adult day service centers, nursing homes, and residential care communities. Next slide, please. In doing all of this work, one of the things that has become very clear is that a major challenge for us to be able to generate really effective and helpful evidence that policymakers can use to address this critical policy challenge is that our data sources right now are really have major gaps. There is a lot we unfortunately don't know about our home and community-based services workforce in particular, which frustrates our efforts to understand just how big the shortage we're facing is, and how good a job we're doing on progress to address it, including how effective many of the investments and also our policy initiatives are. So we think that addressing these data gaps is a really foundational challenge for us to be able to make progress on this issue. And in recognition of that, a key provision in President Biden's Care Economy Executive Order last year was actually to improve the data infrastructure on the HCBS workforce. The Departments of Health and Human Services and also the Department of Labor were jointly tasked with identifying gaps in the HCBS workforce data, opportunities to fill those gaps and issuing recommendations on that. We've been undertaking this work for the past year with a wonderful set of partners across HHS and Department of Labor, shown on this slide. And next slide, please. And over the course of this time, our cross-department work group has been working to identify how to tackle this. We've been looking at what data we have on priority populations of workers, prioritizing data needs, key policy questions and gaps in our knowledge, identifying what key data domains and elements that we would want to collect to answer our highest priority policy questions. We've looked at what our existing federal data sources are and where they might address those gaps, but where we still have remaining gaps that need to be filled, and identifying promising opportunities for filling them. Our work group will be issuing our recommendations next month, which will serve not only as a guide for us as federal partners, but really a call to action more broadly to the field for how we can all collectively and collaboratively close these gaps so that we have the data that we need to assess progress on these policy challenges. The Direct Care Workforce Strategy Center, we believe, is going to be a critical vehicle through which we can continue to engage all of you as our external partners in doing this work together. So I want to thank you all again for the opportunity to share with you our strong support of this initiative. And with that, I'm delighted to turn it over to Taryn Williams of the Department of Labor. Thank you.
Thank you, Tisa Marie, and good morning, everyone. My name is Taryn Williams, and I am the Assistant Secretary of Labor for Disability Employment Policy at the U.S. Department of Labor, and I head up the Office of Disability Employment Policy, or ODEP for short. I want to thank ACL and our colleagues at the Direct Care Workforce Strategy Center for hosting this webinar and drawing attention to this critical issue. ODEP coordinates with agencies from all levels of government, federal, state, and local, to increase disability employment through policy change. Our mission is to develop and influence policies and practices that increase the number and quality, and I truly emphasize quality, of employment opportunities for people with disabilities. Indeed, the Department of Labor is focused on investing in all of America's workers. Our administration, under the leadership of President Biden, has been committed to supporting workers including job seekers and workers with disabilities, and those who comprise the vital care economy. Put simply, Acting Secretary Sue's vision for the Department of Labor is centered around increasing equity and access to good quality jobs with economic opportunity, robust enforcement, and empowered workers. This means focusing the department's resources on advancing equity and opportunity for people of color, women, and communities that have historically been left behind, including people with disabilities. It also means addressing the caregiving crisis, which we know disproportionately impacts women, particularly older women of color. For us in ODEP, this means we prioritize efforts that advance equity and critically to promote competitive integrated employment. ODEP is committed to improving and increasing competitive integrated employment opportunities for all individuals with disabilities. And I'm thrilled to be here to discuss how DOL and HHS and other partners have been collaborating to support this effort by helping to ensure that people with disabilities have access to the direct care workers they need to live, work, and thrive in their communities. Expanding access to competitive integrated employment aligns with our administration's focus on using all our tools to create good jobs. For too long, these critical care jobs have not been provided with the pay, the benefits, and the opportunities for it to be sustainable. These roles are too important for them not to be good jobs. And in 2022, ODEP and other colleagues from across the Department of Labor worked with ACL to convene listening sessions and expert think tanks and to help better understand the underlying factors contributing to the care crisis and to strategize about the best ways to address them. This helped drive our conversations and led to the creation of a report with recommendations for federal actions. This included identifying ways to utilize the untapped potential of people with disabilities to help address the existing care workforce crisis. The CARE Executive Order, which followed, recognized that there is a need, as we just heard from Tisa Marie, for better data and tasked us with using data to improve the care workforce. For the past 6 months, agencies across DOL and HHS have been meeting as part of a working group committed to tackling this very important issue. It is anticipated that we will be releasing our recommendations later this spring. Our sister agency at the Department of Labor, the Women's Bureau, recently released an employment sample agreement for home care workers and a brief on unpaid caregiving and older women in the United States. As a result of these and other efforts, we are working to address job quality and professionalization of the paid care workforce by highlighting state-level best practices and promoting increased access to training, benefits, and union representation. Thank you for the opportunity to highlight the department's efforts, and we look forward to continuing to work with you going forward on this very important and timely issue. I now have the pleasure of handing it off to my colleague, Kim Vitelli, who is the administrator of the Office of Workforce Investment at the Department of Labor's Employment and Training Administration. Thank you.
Thanks, Taryn. Like ODEP, DOL's Employment and Training Administration is really proud to carry out Acting Secretary Julie Sue's vision of increased equity and access to good jobs, and her dedication in particular to good jobs, quality jobs, and the care economy, including direct care workforce. Registered apprenticeships are one of our key tools to get there. It's a proven strategy to expand equitable training pathways into good jobs, including union jobs. In registered apprenticeship, individuals can obtain paid work experience, classroom instruction, and then get a portable, nationally recognized credential. Registered apprenticeships are also the workforce strategy of choice for many employers. because it's an industry-driven, high-quality career pathway where employers can develop and prepare their future workforce. Well, they're also improving productivity and reducing turnover. Some direct care employers are already using apprenticeship as a way to build a stable and trained workforce, and their workers are delivering direct care in good jobs that are good for those workers. ACL's Direct Care Workforce Strategies Center has national guidelines from DOL for apprenticeship standards for direct support professionals. The Department of Labor can also provide technical assistance to any employer interested in creating or joining an apprenticeship program. The website apprenticeship.gov can get you started. In addition to technical assistance to employers, ETA is also investing in the public-private partnerships that expand, diversify, and strengthen the registered apprenticeship system. ETA recently released a funding opportunity announcement for a grant program called Apprenticeship Building America. We'll award $95 million total, with individual grant sizes ranging from $1 to $8 million. One of the activities that the grants will support is creating apprenticeship hubs. Apprenticeship hubs facilitate the establishment and scaling and expanding of registered apprenticeship programs in new and fast-growing industries and occupations. We're particularly interested this year in expanding registered apprenticeship in several critical sectors, including the care economy. The Apprenticeship Building America funding opportunity announcement is on grants.gov already, and applications are due April 15th. The Employment and Training Administration will also make $100 million available for state apprenticeship expansion formula grants. This funding, which is for states, will support integrated and statewide registered apprenticeship strategies and increase the capacity of states to engage industry and also meet the demand for new programs in certain critical industries. And that includes the care economy, and that includes direct care specifically. States can find the funding opportunity announcement for state apprenticeship expansion formula grants on grants.gov, and those applications for states are due April 4th. We are really excited about these investments in apprenticeship and think that they'll really expand apprenticeship in critical sectors like the care economy. But I do want to emphasize that registered apprenticeships are a strategy and a training option available to employers and workers right now. DOL has robust technical assistance available to employers that want to register or join an apprenticeship program. And again, apprenticeship.gov is a terrific starting point, as well as the highlights and the Direct Care Workforce Strategies Center. Thanks, ACL, and thanks, Caroline, for letting me tell everyone about strengthening apprenticeship opportunities in the direct care workforce. Let me hand it back to you, Caroline.
Okay, thank you so much, Kim, and hello, everyone. My name is Caroline Ryan, and I lead the Direct Care Workforce Initiative at the Administration for Community Living. On behalf of ACL, I'd like to once again thank all of our federal leaders for presenting on the call today. I am here to sort of close out our webinar and share some brief information about technical assistance opportunities that the Strategies Center is currently offering. So if we go to the next slide. The Strategies Center recently opened 2 technical assistance opportunities to support states in expanding and strengthening the direct care workforce. There is actually a separate informational webinar tomorrow at 2 p.m. Eastern that will provide additional details about both of these opportunities. We included the registration link in this slide, and it can also be found on the Strategies Center website, which we have included in the chat. There are also a number of resources open to the public, including the Direct Care Workforce Strategies Center website. This website serves as a national hub for resources, including information about best practices, promising strategies, upcoming events, webinars, and technical assistance opportunities. The website also features a resource library that includes all of the resources that you heard our federal partners talk about on the call today, as well as resources published by partners from all levels of government, research and advocacy organizations, nonprofits and industry, and other stakeholders. There is also a monthly webinar series. This webinar is actually the first in the series. So we encourage you to stay tuned for more information about upcoming webinars. They will occur on the 4th Thursday of every month at 2 p.m. Eastern. And you can look for, you can find the schedule for the webinar series on the Direct Care Workforce Strategies Center website, which we again included in the chat. If you'd like to sign up to receive updates and opportunities, we've also included a website to do so on this slide. The information on these slides is also available on the Strategy Center website, and the slides with the hyperlinks will be available after the call. I again want to thank all of the participants on today's call for attending, and we look forward to connecting with you all again on future calls. Thank you so much and have a good rest of your day.
Thank you everyone for attending. This concludes today's webinar. If you have any questions after the end of the webinar, please feel free to reach out at directcareworkforce@ncoa.org. Thank you.